You guys, you don't, I mean, okay. Make sure she has shoes and a jacket if she's gonna be outside.
Can you hear me? JoAnn? Oh, I think I'm muted. Can you hear me, JoAnn? Hello, can you hear me?
Hi, Sam.
Perfect. Hi, how's it going?
I can't hear you.
Huh.
Oh, I can hear you now. I just had my volume
Okay.
down.
Oh, I was like, what? Okay, good. So let me.
Thank you for letting me go in first.
Oh, yeah, I was like, that'll be easier. I'm going to go to schedule, back to meeting details. So I guess the chat is on our agenda page. So I'll have that up, and then I will pull up the PowerPoint here. So what we did yesterday is Brandon went over all of the Medicare Made Clear, and then I did the benefits. Do you want to do Medicare Made Clear and the benefits, and then I can do like the additional like caregiver feature for our Renew, Solutions for Caregivers, Social and Government Referrals, House Calls, and Navigate for Me. So once you get done with the benefits, I can go through some of the additional stuff that I added to the PowerPoint.
We can do it the way you and Brandon did it. I'm okay if you want to do benefits too. It doesn't matter to me.
Okay, let's do it that way. So that way so you'll go through the clarity, and then I'll go through the benefits, and I'll kick it off, introduce myself, and then I'm gonna introduce you, and then you can talk a little bit about yourself, and then go into the clarity guide.
Okay. Oh, I have to
Perfect.
talk about myself? Okay. Okay.
Kind of just like talk a little bit about yourself and say, I'm introducing your local sales agent. She's in New Mexico. She's going to be a resource for you. Her contact's on the screen. And then you can talk a little bit about yourself and then go into the agenda and stuff. So go ahead and play from the beginning here. Actually, I'm going to escape quick. So I want to make sure I don't have anything in the background. Okay. Okay, cool.
Eddie, can you call Arissa? She keeps calling my phone. I need to silence my phone. Eddie. Let me go tell my husband something real quick.
Okay, that's fine.
Can you call Arissa? She keeps calling my phone. Okay. And don't forget, you have something on the stove while we're cooking. All right, I'm back.
Okay. So when it gets to a certain point, we have to broadcast it. And I talked to Denise this morning, and she said that people, if they're having trouble seeing it in the meeting, they'll actually go into the Zoom. So people won't actually be in our Zoom, but people are watching, if that makes sense.
Okay.
Yeah, so I will. Do you see anywhere like a broadcast button?
On the, let me see. Speaker only. No. So if we hit manage, no.
Okay, I think when it gets to like closer, we'll see a broadcast button, and then we'll click that, and that will basically broadcast our meeting. So we'll just wait for that.
Did anyone come by the booth yesterday?
No one came by the booth yesterday, but we had a lot of people watching the presentation. So I think since yesterday was more of the professional caregivers, and I'm wondering if we'll get more people come by today because it's the family caregivers. I think that would be, yeah, that's what I'm thinking.
I was trying to figure out how to get into our booth. Like you can go into the exhibitors and go into the exhibiting hall, and I thought you would think you could just click on the booth, but when I click on it, I don't get into anybody's booth.
Huh.
So I'm pretty good with technology, and if it's not that easy for me, I don't know how easy it is for everybody else.
Yeah, that's what I'm thinking too. So going to like the exhibitor call here. So I can see.
For a full conference program, click here. So if we go there, I'm just going out like if I'm a guest. What's downloading a program? What was Presbyterian presenting?
I have no idea.
Or maybe
I
they
see
were.
Arlo. I don't think they were presenting. I just think they were a sponsor.
Oh, okay.
Medicare corner. Blue Cross Blue Shield, Molina. You can like click on it.
I've clicked on them and I can't get in. It just makes my screen bigger.
Oh,
Does it-
I got in. You have to click on like a little button.
The blue
Like the
thing?
little blue button, like double click and then click on the hyperlink to United Healthcare.
Okay, let's see.
And then it says enter
Oh.
virtual. So, yep.
Wait, no, mine's still making mine big. Hold on, let's see. I'm going into blue.
So our booth starts in 2 hours. It's at 1:15 to 2. And then our presentations right now. So if we go into,
So it lets me into our booth, but not the other ones. Maybe because we're administrators.
maybe, that could be why, that's weird.
Do you just keep, oh, those are just, okay, that's the Medicare Main Clear and the United.
Hey, in that chat, do you want to put also your phone number? So then even if they don't join the meeting, they can see that on there.
Yes,
I'll put it there.
I'll put my email and my phone number. Let me go to my chat. It's slow.
So I'm going to give Denise, I'm going to text Denise. Because I'm going to say I don't see a broadcast. Do you see a broadcast button?
It says we're live right now. Just started broadcasting.
Oh, it did?
It just started blinking live just now.
Okay, yep, we're ready to go. Let's go ahead.
All right. Are you going to start the introductions?
Yep. Okay, well, thank you everyone for joining today. We're going to wait about 1 more minute to get started, and JoAnn and I are going to talk about Medicare Made Clear and United Healthcare and how we can help those that you care for get the help that they need with their health care. So give us about 1 more minute, and we're going to wait for a couple more people to join, and then we'll get started.
I see there's some people on.
Perfect. All right, well, welcome everyone. My name is Samantha Anderson. I'm the Business Development Manager for United Healthcare for Northern New Mexico. Today, JoAnn and I are going to talk about Medicare, what it is, and how we can help those that you care for get more access to care and benefits that will help them and you live healthier lives. So let's go ahead and get started. Before I do change the slide here, we have JoAnn Medina's contact information on the screen. I would make sure that you jot that down, put it somewhere, take a screenshot, because she's a local representative that can help you make decisions for those that you care for and yourself in regards to Medicare products. So let's go ahead and get started.
Well, things about Medicare. Are you ready?
Yeah. So we're going to
go ahead.
Oh, I was going to say, today we're going to talk about Medicare Advantage, and we're going to talk about what Medicare is and who qualifies. And as I mentioned earlier, I'm Samantha Anderson. I am United Healthcare's Business Development Manager for Northern New Mexico. And today presenting is going to be JoAnn Medina. She's a local representative and agency owner. So go ahead and kick it off, JoAnn.
Hi, thanks, Sam. Things are getting ready to be very clear. Medicare can be a very confusing, complicated world, and local representatives and local agents like myself and my team of agents help make things more clear by explaining how Medicare works, and that's what we hope to accomplish today, is to help it make it more clear for our viewers. I'm ready for the next page. So today this is our agenda. We'll be understanding your Medicare choices, eligibility and enrollment, Medicare Advantage, prescription drug coverage, 2021 Medicare Advantage plan information, agent assistance, additional resources, and why United Healthcare. Next page, please. Sam. I think we lost Sam. She went blank and the screen went grayscaled. Let's give her a minute to see if she comes back. Technology, you gotta love it. We can't live with it. We can't live without it.
I'm coming back on. One moment here.
Okay. Thank you.
Yeah. All right. Here we go. Can you see my screen?
No, not yet. It's still loading. There we go. So step one, enroll in Medicare. When you enroll in Medicare, you get a card that says Part A and Part B. Part A covers your hospitalization and inpatient care, and Part B covers your doctor's visits and outpatient care. In 2019, they changed the Medicare card to remove the Social Security number and just put a generic number, which is a combination of letters and numbers. They did that to protect the identity of our seniors. Next page. Once you have enrolled in original Medicare, Part A and Part B, then you have choices past that point. The first step is just to enrolling and making sure you have A and B. Once you have A and B set up with the Social Security Department, then you have choices 1 or 2. Option 1 is purchasing a Medicare supplement and a Part D program, and the Part D covers your drugs, and the Medicare supplements assist you in paying co-pays and your out-of-pockets. These have monthly premiums that go on for every month. So the monthly premiums are charged every month. Or you can choose Part 2, which is the Medicare Advantage plan. A Medicare Advantage plan, which is sometimes called Part C, is Part A, B, and D managed by a private company like United Healthcare. Part C combines Part A and B into one plan, and most of the plans include Part D. Many of these Part C Medicare Advantage plans offer additional benefits not provided by original Medicare. I always like to point out one additional thing here. If you do not select a supplement or a Part C plan and you just stay on original Medicare and Part D, you have no maximum out of pockets. So the original Medicare is a traditional 80-20 plan, and the maximum out of pocket comes into play when you're on a Part C plan. When your bills get to a certain amount, you're covered at 100% on a Medicare Advantage plan. If you have more questions about that, just see me later. Eligibility and enrollment. Well, first you have to be eligible for Medicare, and that's Part A and B. You have to be eligible for Medicare, you have to be at least 65. You could be under 65 if you have a disability or other special situations, and you have to be a U.S. citizen or legal resident that lived in the United States for at least 5 consecutive years. When you enroll in a Medicare Advantage plan or prescription drug plan, you have your initial enrollment period. It's 7 months long. It includes your 65th birthday plus 3 months before and 3 months after. It begins and ends 1 month earlier if your birthday is on the first of the month. You may enroll in Part A and B or both. You may also choose to join Medicare Advantage Plan Part C or prescription drug plan at that time once you have A and B. Although you're not required to enroll in a Part D, there is a penalty of 1% of the average monthly premium for each month you delay enrollment. And that penalty is not a one-time penalty. That penalty is a monthly penalty for the rest of your time on Medicare. A lot of people don't like to choose the Part D when they first turn 65 because they take no prescription drugs. But if Part D is not selected, that penalty will stand. Eligibility and enrollment. So every year, there is an annual enrollment period from October 15th through December 7th. That's the time we are in right now. During annual enrollment, you can add, drop, or switch to Medicare coverage. Medicare Advantage open enrollment period is from January 1st to March 31st. If you're already on a Medicare Advantage plan or a plan member, you may disenroll from your current plan and either switch to a different Medicare Advantage plan one time only, or to go back, or you can go back to original Medicare during this period. There are special enrollments throughout the year. Depending on your circumstance, you may be able to enroll in a Medicare plan outside of the initial enrollment period or annual enrollment period. Some of you may qualify for a special enrollment period if you've retired or recently lost your group coverage, if you moved out of the plan service area, if you qualify for extra help. And one of the things about working with a local agent is they know your local rules and they know the local guidelines for qualifying for these extra help programs. And many of you may not qualify for Medicaid because you have to be below $776 in monthly income, but you qualify for Medicare savings programs and extra help with prescription drugs. And local agents like myself and my team of agents can help you get qualified for those programs. If you have been diagnosed with a certain type of chronic health conditions, that would also open up a special enrollment. The advantage of Medicare Advantage. Medicare Advantage plans have higher member satisfaction. 24+ million people enrolled in a Medicare Advantage plan as of February of 2020. 93% satisfaction among seniors with a Medicare Advantage plan, and 25% less on health care compared to original Medicare. The advantage of Medicare Advantage. Compare your coverage. Original Medicare doesn't cover all medical expenses and it doesn't cover prescriptions. Benefits and features. So we have two columns here. The blue column is Medicare Advantage and the light blue column is original Medicare. Coverage for hospital stays. Both cover hospital stays. Coverage for some medical care like doctor's visits. They both cover medical care. Preventative service like flu shots, they're both covered. But what's not covered on original Medicare is your prescription drug coverage, your routine vision coverage, your routine hearing and hearing aid coverage, limits on your annual out-of-pocket cost. That's not covered. And to me, as an agent and as a daughter of aging parents, that is a huge, huge risk that people take by staying on original Medicare, because it's 80-20 and there's no maximum out of pocket. I can't stress this enough. You put yourself at risk for a lot of debt when it comes to medical bills. I lost Sam again. Sam?
Here, I'll reshare. I'll share the screen again.
Thanks.
Can you see it?
It's loading. It says it's loading. Okay. The advantage of Medicare Advantage. 10 things you need to know about Medicare Advantage. 1, you must continue to pay your Medicare Part B. So like I said at the beginning, you have to enroll in Medicare A and B with the Social Security Department. You have to maintain those and keep them in good standing throughout the year. 2, Medicare Advantage has you covered. 3, join a Medicare Advantage plan. Joining a Medicare Advantage plan may affect your current coverage. 4, it's best to use network providers. And 5, you may qualify for financial assistance. Okay, 6, if you enroll in Part D late, you may incur a penalty. There are some exceptions to get around this penalty, and a local agents like myself and my team can help you determine if you qualify for any of those exceptions. 7, a Medicare supplement insurance plan, Medigap policy, is not a Medicare Advantage plan. 8, keep your member ID card handy. And 9, Medicare Advantage offers the same protection as original Medicare. 10, you have a built-in financial safety net. Prescription drug coverage, understanding Medicare during the payment stages. So you have an annual deductible on some of the drug plans, 100% until you reach the plan deductible. The plan pays 0% of the drug cost while you still need to make the deductible. And it varies by stage if the deductible applies. So there are 5, 6 stages of drug tiers, and the deductible may not affect all or some of the tiers. The initial coverage. In the initial coverage, you have a copay or co-insurance. And the plan pays the balance after copay and co-insurance. The total drug cost, once your total drug cost of co-pays reach $4,130, you move to the next stage. And that's the coverage gap, better known as the donut hole. The donut hole, the member pays 25% of the drug cost, and the plan pays 5 to 75% of the drug cost. Once your total out-of-pocket cost reach $6,550, it moves you to the catastrophic stage. The catastrophic stage. Once you're in the catastrophic stage, the member pays $3.70 copay for generic drugs, including brand name drugs treated as generics, and $9.20 copay for all other drugs, or 5% coinsurance for all drugs, whichever is greater. The plan's going to pay 15% of that cost, and they'll do that through the end of the year, and then the whole thing starts all over again. What local agents
Hey, JoAnn,
Yes.
real quick, you're a little bit crackly. Do I sound crackly on your end? Like robotic?
No.
Is there a way you can change your sound? Because I think some of the members are the visitors are hearing a little bit of a crackly sound when you're speaking.
Okay. Let me see.
Hang tight. We're just going to make sure that JoAnn sounds a little bit more clear.
Everyone here's crackling. I could try to call in on my phone.
So now that you're closer, you sound less crackly. That is better. So since you're closer to the computer,
Yep.
So I would just see if you can be as close as possible.
Okay, so I'll stay closer. So getting back to the prescription drug coverage and how it works and how the different stages of the drugs work. Agents, if it's a good idea to check your prescription drugs every year with your agents to see how they're covered in the formulary of your plans, because every plan has a different formulary, and different drugs are in that formulary, and your drugs are covered differently. Even though the plans are similar, your drugs are covered differently by each plan. So it's a good idea to review your drug coverage with your agent every year. And if you don't have an agent, feel free to call me.
JoAnn, I'm sorry. I would say you should call in because it's still crackly.
Okay. Let me find the number then.
Yeah, if you go to the audio, you can switch audio. And while she's doing that, what JoAnn is going through
Can you
is
hear me
the
better now? I
phases.
switched the type of audio I have.
Yeah, let's try that.
Sam?
Yep, I can hear you better now. It just gets, we can hear you, but it gets very crackly. Yes,
Sam,
so
you want to go ahead and continue while I get set up?
yep. So I will continue. So I got a
can
question.
Jump back in here in a second.
Yep. So we had a question from Andrea that she can't hear at all, but these are being recorded, so they can be heard at a later date. Am I clear to everyone on the presentation? Can you hear me? All right, perfect. So what JoAnn is talking about here is the phases of drug coverage with Medicare. So with that, we have the annual deductible. Typically, that's what you pay until you start paying the lower copay with the plan. Then the initial coverage limit is the copay or coinsurance for those drugs that are covered by the plan. Then we have the coverage gap, which is typically referred to as the donut hole, where members pay 25%, but not the full cost for their covered drugs. And then once you reach a certain amount of $6,550, then the member will pay no more than $370 for generics, or $9.20 for all other drugs, or a 5% coinsurance for all other drugs. So with that, this is what happens with any Medicare Advantage, any prescription drug plan associated with Medicare. This is not plan or company specific. This is with Medicare. Now, when it comes to prescription drug coverage, there's a difference between total drug cost and out-of-pocket cost. The total drug cost is what you are paying, or the member is paying, for prescription drugs each year, plus what your plan pays. And this does not include the premium. This is just prescription drugs. And then there's the out-of-pocket cost. This is the total amount you pay for prescription drugs, including your deductible and any discounts paid by drug manufacturers while you're in the donut hole. And this does not include what the plan pays or premium. Then there are members that get, or Medicare beneficiaries that get what is called extra help from Medicare with their Part D cost. JoAnn and her team can actually help any of those that you serve or work with apply for extra help for medications if you believe that they are eligible. That's the great advantage of having a local representative like JoAnn. So prescription drugs. So we have a pharmacy network, and with United Healthcare, we have in network 65,000 pharmacies that our members are able to utilize for lower drug costs. When you're using in-network retailers, you get even lower cost. And then we also have Optum RX, and that's our mail delivery service. So we deliver medications for a 90-day supply to members at lower cost. Now, when it comes to prescriptions, they're tiered, and this is, again, with any prescription drug plan or any Medicare Advantage plan, and they're based on tiers 1, 2, 3, 4, and 5. And as you can see, it goes from generic to specialty drugs. So your tier 1 and 2, your preferred generics, and generics are going to be lower costing. Then your tier 3, that's going to be your preferred brand drugs, and tier 4 is your non-preferred brand drugs, and the tier 5 is your specialty drugs. So those are going to be a little bit more expensive as you go up through the tiers. Most beneficiaries are on tiers 1, 2, and 3. Tiers 4 and 5 are not as common. So prescription drug coverage. So when it comes to prescription drug coverage, there are regulations to make sure individuals are taking their drugs safely. And there's 3 of those main utilization managements are step therapy. And United Healthcare can help you save money on prescriptions by offering lower cost drugs that can treat the same medical condition as current brand name. We also, with Medicare, have quantity limits. So some drugs have quantity limits where the plan will cover only a certain amount of drugs for one copay or over a certain number of days. These limits are in place to ensure safe and effective use of drugs. Especially, for instance, any pain medication, we have those quantity limits, and Medicare places those quantity limits to make sure they're being used safely and effectively. Then there's prior authorization. Before the plan will cover certain drugs, it may need more information from the members or your doctor to make sure the drug is being used correctly for a medical condition covered by Medicare. And you may be required to try a different drug before the plan will cover the prescribed drug. If that's the case with any medications that you or those that you care for are taking, we have a great member services team that can help walk through the process as well. And then we have asking for exceptions. United Healthcare does a really great job. If there is a medication that isn't on our formulary, members can ask to the plan to cover a drug if it's not on the drug list. And this is known as a formulary exception. And then they can also ask to waive coverage restrictions or limits on drugs, and it's known as a utilization exception, which is really great about United Healthcare. If your doctor has submitted an exception request on your behalf, generally the plan will make that decision in 72 hours. And that's a pretty quick turnaround when there needs to be an exception done for a medication, because we want to make sure that our members are safe and healthy and getting the medication and care that they need, even if it's not necessarily always covered on our plan. So you can request that to be expedited or fast as well, if you or your doctor believes that your health requires it. So really great that it's something that we not only have great benefits with our organization, we also are an awesome organization, and we want to make sure people get access to what's important to their health. And so now what we're going to go through is our 2021 Medicare Advantage plan information. Now this is, these plan benefits are for Santa Fe County. If you do live in other areas, please reach out to JoAnn, because she works basically pretty much in the whole state of New Mexico. Is that correct, JoAnn? I think you're on mute. I can unmute you.
Yes, I have agents in all areas of New Mexico, and bilingual agents also.
Yep, so she has bilingual all of New Mexico, so she can tell you what's available in all areas with United Healthcare, and she can tell you if United Healthcare isn't quite the right fit for you. It is a great organization. She also can help you with that as well. So for Santa Fe, we have 3 plans available. We also offer a plan for those with Medicare and Medicaid. And again, please reach out to JoAnn, because she can present that plan to you. It's called our United Healthcare Medicare Advantage Assure PPO. So that's for people with Medicare and Medicaid, and she can tell you all about that. But today we're going over our Medicare Advantage plans. So we have a PPO, so the AARP Medicare Advantage Choice Local PPO. We also have the AARP Medicare Advantage HMO, and then we have the AARP Medicare Advantage Patriot Local PPO. So those are the 3 plans that we offer for individuals that don't have Medicaid but are on Medicare. That Patriot plan that we offer, that's for individuals with VA or TRICARE for Life. It does not offer prescriptions, because those individuals already have prescriptions, but they might want additional benefits, or more access to doctors outside of those VA doctors. So let's focus on the Advantage PPO and the Medicare Advantage HMO. So you can see here that the PPO has a $13 premium. The HMO has a $0. What's really, really great about our PPO and our HMO is that our PPO has what is called a national network. So if you're traveling to Florida, Arizona, Texas, Colorado, you have access to over 850,000 providers across the US with our PPO. And you're paying in-network costs. You're not paying out-of-network costs, you're paying in-network costs because we have 850,000 providers across the US that accept our PPO and participate in our national network. Then with our HMO, this is not a common thing. We have what is called a passport. So you can also activate this passport if you're traveling and need to use in-network doctors in another state. So you can actually pay in-network costs with an HMO in other states by using the passport benefit. I just thought I would highlight that because that's just another awesome thing about United Healthcare and how we really do care about providing a great access to care to everyone that's a member with our organization. So let's move on to the benefits here. So for primary care, it's a $10 copay for the local PPO, the AARP Medicare Advantage Choice, and it's a $5 copay for the Medicare Advantage HMO. If your member is going for their yearly wellness visit or checkup, that will be $0. For specialists with the PPO, it's $40, and then for specialists with the HMO, it's $50. What's really great about all of these plans is if any of the members need to see a specialist, there is no referral required. Preventative services like flu shots, mammograms, colonoscopies, those are $0 across the board. And then you can see for inpatient hospital care, it's $295 per days 1 through 6 for our PPO and HMO. And then for our Patriot plan, it's $275 copay for days 1 through 6. What that copay includes is everything that happens in that hospital room: surgery, doctor copay, anesthesiologist, room and board, medications administered. Anything that happens in that hospital room is what's included in that copay. After those 6 days, if the member is staying longer, it is $0. And then another thing to keep in mind as well is that if you're on original Medicare, you're paying 20% for everything. So you don't know what that bill is going to be. And this helps you understand how much you're going to be in for. And then we're going to talk about shortly that you also have a protection with a max out of pocket. So I'll show you that shortly. For skilled nursing facilities, that's the same across the board. It's a $0 copay per day for days 1 through 20, and then $184 copay for days 21 to 41, and $0 copay per day for days 42 through 100. It's a little bit different as far as days go. For the HMO, you can see that copay goes from days 21 to 47 for the HMO, and the $0 copay is from days 48 to 100. And then for the Patriot, the days change a little bit as well, as you can see on the screen. And again, if you need access and you want to have more information or need a summary of benefits of these plans, again, please reach out to JoAnn because she can get you this information. She can show you where to find it. She can really help you understand these benefits and make that decision. So for outpatient surgery, we have, it's kind of a range here because it depends on what you're getting done. So for our PPO, it's a $0 copay. It's a $0 copay to $195 copay for type 1. And for type 2, it's a $0 copay to a $295 copay. For the HMO, it's $0 to $175 for type 1. And for type 2, it's $0 to $275. And then for our Patriot, it's $0 to $150 for type 1. And for type 2, it's $0 to $250. So what is type 1 and type 2? Okay, so type 1 is your ambulatory surgical center. So it's kind of a standalone surgery center. And then your type 2 is a surgery center within a hospital. So that's something to keep in mind as well. So why are some $0 copays? So with United Healthcare, if an individual gets a mammogram or colonoscopy, and let's say you get a colonoscopy and a polyp is found. Well, in some cases, even though a colonoscopy is preventative, if you're on original Medicare and they find a polyp, that's going to be charged as an outpatient procedure. With United Healthcare, if a polyp is found, it's still going to be $0 if they have to go in and remove it or test it. So as far as diabetes monitoring supplies, we do have $0 copays for your glucose monitors if you have AccuCheck or OneTouch. So if you or someone that wants to be on one of our plans needs a glucose monitor, we have $0 copays for select brands, which is really great because that stuff can get expensive. Another thing is when it comes to home health care, that's going to be a $0 copay. However, the provider has to basically say that the individual is homebound and cannot leave the home, and it has to be referred by the provider. But that is $0 copay for up to 35 hours a week. Keep in mind, this is not cooking and cleaning. This is like physical therapy, occupational therapy, and drug administration. Diagnostic radiology services, $0 copay to $115 copay for our AARP Medicare Advantage Choice local PPO. For our AARP Medicare Advantage HMO, it's a $0 to $145 copay. And then for our Patriot, it's a $0 to $115 copay. Again, depending on the service, and our member services and the doctor's office can help you determine that copay depending on the service that you're going to be getting. And again, I'll just reiterate. Yeah, go ahead.
Can I interject here on the diagnostic radiology services? Since I represent all the plans, those are the lowest, some of the lowest prices for that service comparative to the rest of the plans in the area.
Yeah, so that's a really good point to bring up, because when it comes to MRIs and CT scans and CAT scans, I mean, just being able to pay $115 like on our PPO, that's so low. I mean, I've got an MRI before and it's been about $400. So, I mean, I'm not on Medicare, but they're very expensive. So diagnostic tests and procedures, so those are going to be a $25 copay across the board. Our lab copays, blood drawn, urine, those are going to be a $0 copay across the board. X-rays, $15 copay across the board. And then when it comes to ambulance, and I think I've heard JoAnn mention this before as well, it's really great and important that you have a copay for both ground and air, especially in New Mexico. And would you want to kind of talk about that a little bit, JoAnn?
So not all the plans cover ground and air. They only cover ground, or if they cover air, they cover the air ambulance at 20%, where the member pays 20% of whatever the bill is. A short ride in an air ambulance could be $80,000 just from one side of Albuquerque to the other. So from Santa Fe to Albuquerque, it could be $80,000 to $100,000. United Healthcare covers both at the same copay at $250,000, $250. And so this would include not only maybe from Santa Fe to Albuquerque, but if you had to go for a procedure in a hospital outside of our state, it would include the air ambulance through that way also.
Yes, and that's a really good point to make, because those air ambulances can also be extremely expensive. So when it comes to emergency care, we have a $90 copay across the board within the United States. If you are traveling to another country, it's actually a $0 copay. So $0 copay worldwide, $90 copay within the United States. The copay will be waived. Let's say if you go to the emergency room and then you have to be admitted, that will be waived, and then you'll pay that inpatient copay. Urgent care, it's a $30 to $40 copay. So you can go to urgent care with a facility that is non-contracted on any of our plans. And again, the copay is waived if admitted. So when I was talking about earlier, I was talking about annual out-of-pocket maximum. Oh, go ahead, JoAnn.
So only on emergency room visits are the copays waived. On urgent care, the copays are not waived if you're admitted.
That's an important point to bring up as well. When it comes to the annual out-of-pocket maximum, this is what basically protects you from spending too much on your medical costs throughout the year. And I kind of want JoAnn to talk about these. So go ahead and talk about these annual out-of-pocket maximums.
So the annual out-of-pocket maximum is all your copays and out-of-pocket expenses added up. And you're thinking, well, my copays aren't very high when you look at the plan. It's $5 or $10 or $50, 115 for the MRI. I'm never going to get there. But there are a few line item coverage like dialysis, which is covered at 80% by the plan and 20% by the member, or chemotherapy or Part B drugs that take place in an office visit. Those are covered at 80% by the plan, 20% by the members. And you can reach this maximum out of pocket in 1 month if something goes wrong. Or if you're in a car accident and you're severely injured, you can reach this maximum out of pocket quickly. And so once your bills get to the maximum out of pocket, in the PPO, it's 3,800. In the HMO, it's 4,900 and 4,300 in the Patriot. Our plan covers at 100% until the end of the year. It resets itself every year, but this is ultimate protection from serious medical debt.
Absolutely, so true. And that's why it's important to really consider these types of plans to really protect yourself from having those giant medical bills. Mm-hmm. When we look at medications, you can see that, as I mentioned earlier, medications are kind of weighted on tiers. So typically your tier 1 and tier 2 are less expensive. And as you go up in tiers, they do cost more. You can see here that we also have a 90-day supply. That 90-day supply is actually referring to our Optum RX mail delivery. So you can also get 90 days through the pharmacy, but it's going to be a little bit more. But if you do get 90-day supply delivered at home, for tiers 1 and 2, you're paying $0. So you can get your generic drugs like your metformin, your levothyroxine, your statins for $0 for 90-day supplies, which is a really great benefit that we offer through Optum RX. And even if you do get those brand drugs, the copay for 90-day supplies is a little bit lower as well. And as you go up to your tier 4 and tier 5, those specialty drugs, there's a bit of a co-insurance for those. And our specialty drugs, tier 5 specialty drugs do not have mail delivery. As far as prescription deductible goes, there is no deductible for your tiers 1 through 3. But if you are taking a tier 4 or 5, so non-preferred or a specialty drug, there is a $150 deductible for those medications. Again, as I was mentioning earlier, I started my career as a telesales agent, so I worked with all people across the 50 states. So most people are typically on tiers 1 and 2, and many are on tiers 3, but I rarely talk to people on tiers 4 and 5. So most people are on those lower costing medications. But if you are, go ahead, JoAnn.
Can I interject one more time? I'm sorry, Samantha, but there is something on this chart that has changed for 2021 that's not included, and that's the insulin program that United Healthcare has. So the insulins that are in formulary for United Healthcare, because like I explained earlier, the formularies are different for each plan. They are maxed out at a $35 copay for our members. So if the insulin you take is in formula, your copay will be $35. Even if it's a level 3, a level 4, it will only be $35. And it's listed in our benefits book, in our enrollment kits that we send out.
Absolutely. That's a very good point to bring up too, because as JoAnn was talking earlier about the coverage stages, if you go into a coverage gap, typically people that were on insulin in previous years would actually pay a lot of money for those medications. No matter what phase you are in, if you're taking insulin, you will pay no more than $35. So that is a really great benefit that we do to protect our members from those costs.
And as I'm going through people's drugs coverage, reviewing it for the next year, my clients that have generally fallen into the donut hole are not going into the donut hole this coming year, because I do the projection year month by month, because of the insulin coverage being maxed out at 35. So it's a significant change for our members this year.
And when we look at these next benefits, so for a monthly Part B premium credit, our HMO and our PPO with prescriptions do not have that. but our Patriot plan actually offers a $50 rebate. So what that means is everyone pays a Part B premium. So members will get $50 basically back for their Part B premium. So they're going to be paying $50 less a month for Part B. And that is only for our Patriot plan. And then you can see here, as I was mentioning, our PPO has the national network. Both our PPO with drug coverage and our Patriot have that national network. Our HMO has what is called a passport. And if you set up an appointment with JoAnn and talk to her, she can explain how the passport will work if the HMO is the appropriate plan for you. Our Patriot plan offers dental embedded into the plan. So if you will get $500 covered for dental services, and then you will also get preventative like exams, x-rays, routine cleanings and fillings covered with that plan. With our HMO and PPO, we have optional riders available, and members will get up to $1,500 a year in comprehensive coverage and preventative coverage as well. And again, JoAnn can go into more detail if you set up a one-on-one with her. All of our plans are a $0 copay for routine vision care. So if they need to get their eyes checked. And then also one thing I want to mention is that we have an exclusive relationship as an organization with Warby Parker Glasses. It's an online glasses vendor. You can go online and see what glasses they offer, and you can put send your prescription to them, and they can send you like 5 glasses to try on, see how they look, and then you can order them in person. They're great. They're low costing, but they look like designer glasses. It's called Warby Parker, WARBY. As JoAnn was mentioning, we're participating in that Insulin Savers program. So members pay no more than $35 for covered insulins. Some of the insulins we cover are like Humalog. I can't really think about most of them off the top of my head, but we do cover the quick pen injections as well. And then we have an over-the-counter benefit with our Patriot plan. So members get up to $160 per year to buy over-the-counter products delivered to your home. All of our plans offer a gym membership with Renew Active. So members will get pay $0 to go to the gym. And I'm going to talk a little bit about why it's a really great benefit, because caregivers can actually go to the gym with members this upcoming year. And that's something I want to highlight. Yeah, I really wanted to highlight, JoAnn and I were really excited to talk about that with you all. And then another great thing is not only do we care about the fitness of our members, we also care about the mental well-being. So with our Renew program, we have access to brain games, recipes, music, Renew Positivity, and members actually earn up to $120 for completing healthcare activities like tracking their steps or going to their wellness visit with their doctor. They'll get Visa gift cards in the mail for just being healthy. So awesome benefit that we offer with Renew Active. And I'm going to stress it again. JoAnn can show you how everything works and talk through all of this with you. Another great benefit.
Can I chime in on that Renew Active? So during COVID, all the carriers did something a little special for their members, but United Healthcare really went above and beyond. As I'm meeting with my members and they're telling me the little goodies they got sent because the gyms were closed, they couldn't stay active, and it's imperative that our seniors stay healthy. They were sent everyone sent out the hand sanitizers and the mask, but they were sent exercise stuff like stretch bands, Fitbits. They all got Fitbit watches in the mail. And I'm telling you, they felt so special. This coronavirus and keeping everybody home, shutting restaurants down for seniors, that's the only thing that they do to get out. It was like they felt very special getting that kind of stuff in the mail. And United Healthcare went above and beyond during COVID for their members. Thank you, Samantha.
Oh yeah, that is a great point. And that's what and again, I'll stress this, is as an organization, it's not just about the benefits. We do so much above and beyond just offering a health insurance plan. We care about helping people live healthier lives. So another thing for 2021 is that we're going to have $0 copays for virtual medical and mental health this upcoming year. So we know not everybody is able to leave the home, and mental health is so important, especially during times like today. So we do offer we're going to be offering $0 copays for mental health for our members to meet with their mental health provider in the comfort of their home. So really great offer. And then also with medical visits as well, being able to pay a $0 copay. I know myself, I had to go to a dermatologist over the phone, and I still had to pay a $40 copay. So, and I just had to answer a few questions and had to pay $40, and it took 5 minutes, and I wasn't very happy about it, but that's okay. So one of the benefits I wanted to bring up, and JoAnn and I are super excited about, is the Caregiver feature for next year. So this upcoming year, when a member is going to the gym, the caregiver will actually be able to go to the gym at no cost with the member. So really what that means is with certain Renew Active gyms and fitness locations, at no additional cost you can go. So the intent of this feature is to allow members to bring a caregiver to the gym for the sole purpose of assisting members while at the gym. So getting into the pool, onto the treadmill, or being there to support exercise. So that's really great, because I know that typically, like if I were going to go to the gym with my mom, I have to pay $20 to go to that gym with her. You know, you only get so many free guest pass a month. So be able to go maybe a couple times a week and not have to pay is a great benefit, because exercise is so important physically and mentally too. And then a caregiver, as defined with United Healthcare, we're defining that as a person who is 18 years of age and older that has a significant responsibility for managing the well-being of a person diagnosed with a chronic or debilitating mental or physical medical conditions. So not all gyms allow caregivers, but to be able to see what gyms do, you can actually go to the Renew Active website, and then you can see, you can type in your zip code and see what gyms are available. And right on that website, you'll be able to see if caregivers are allowed. And JoAnn can help that to you too. So, moving on here. So we have another great benefit for our caregivers. And make sure that you write down this website. It's www.uhcforcaregivers.com. So with this website, we offer expert information to help you create the best plan of care. We customize resources that meet your needs as a caregiver. We have so many discounted products and services that save you time and money. And then we also have a dedicated team of clinicians and experts to help you as a caregiver. So please, please, please write down this website. This is an awesome benefit that we offer. And again, I'm going to stress this, you really need to, if you're not a member of United Healthcare or you're interested, please reach out to JoAnn, because she can really help you. Here's another benefit that we're offering above and beyond just, the plan copays or medical services. We know it's important to look at the person as a whole, and socioeconomically as well. So we offer a program at no cost called Social and Government Referrals Program. So what this does is we assist our members with payment of Medicare Part B premium and enrollments if eligible. And then we also have helped them with recertification for Medicaid and extra help for their medications. We also help with community assistance. So if a consumer feels that they need help with food, utilities, housing, and et cetera, that's going to be no cost to the member, and we will help them get access to what they need. And we also help our veterans. We help them with coordination of care and collecting their medical charts to make sure that that's coordinating if they go to a civilian doctor. Another benefit we offer is house calls. So for house calls, we actually have a practitioner come to the comfort of the home of our members, and they do a more personable wellness checkup basically, and then they coordinate that with their primary care doctor. And what that does is it really helps fill in those care gaps, because if a member doesn't go to the doctor quite often or really can't get to that primary doctor, these house calls practitioners can come and make sure that, if anything's missing, if they need care, if something's urgent, they can get them to the correct doctor and get that information to their primary care to help close those care gaps and make sure that they're being taken care of. So it's a great benefit that we offer. It's no cost to the member. And you can see here on the screen that we had 10 million care gaps closed in 2020 and more coming. So it's a really great benefit. I encourage anybody that's part of our plans to take advantage of it. Because sometimes when you go to that wellness visit, it's kind of an in and out. This is really a more personable experience for our members. And I have someone that I work with, and he was telling me his house call visits, they even brought him a blanket this year. So it's a great one. Another benefit that I wanted to highlight was our Navigate for Me. So this benefit is really someone that's going to be one point of contact for a member, and they in the name, and it's pretty similar. They help them navigate our healthcare system. They help them make appointments and get access to and understand plan benefits as well. So this is for our members that have new cancer diagnosis within 60 days. They experience a cardiac event, they have a joint replacement or chronic back pain or a recent fall, or they have COVID-19. We've done a lot of help with the pandemic this year. So if someone's been diagnosed with COVID-19, we help make sure that they get access to care or make sure that they have access to food as well. And throughout this pandemic, we've actually served over a million meals to members across the U.S. with our Navigate for Me program. And we want to make sure that we can help our members with their pharmacy, financial, and socially and behaviorally as well. So agents and agency owners like JoAnn, if they have a consumer or a member that they have with one of our plans, they can actually recommend them for one of these programs to make sure that, if they identify a member and they say, oh, this person, had a recent fall, I'm going to make sure that I help them get a navigator so they can make appointments and get the help that they need. So it's a really great benefit. So why United Healthcare? I'm going to have JoAnn go through these slides. So JoAnn, why United Healthcare?
Well, not all Medicare Advantage plans are the same. Many private insurance companies offer Medicare Advantage plans, but when you choose United Healthcare, you're choosing an industry leader. You're not just choosing a name, you're choosing a proven system. From member services to broker services, the service is above par. I work with all the carriers, so I know what it's like to call their broker services and to call member services with their members. And anytime you call United Healthcare, it is a pleasant experience. I have yet to have an unpleasant experience. And being in the service industry, you sometimes have a higher standard for service, and United Healthcare has been able to meet that for me and my members. So reasons to choose United Healthcare: for more than 40 years, they've been serving our Medicare community. More people choose United Healthcare for the Medicare plans than any other insurance provider. Members like and keep our Medicare Advantage plans. Our retention is high. Last but definitely not least, you have our promise and our commitment to helping you live a healthier life. And United Healthcare and the team at United Healthcare really does care. It's a perfect name, United Healthcare.
So when it comes to additional resources, we have the Medicare Made Clear. And if anybody wants the Medicare Made Clear guide, JoAnn or myself can get that emailed to you or sent to you. There's the Medicare helpline, Medicare and You. There's online plan finders, and JoAnn can help you find plans with our websites as well. There's state resources. Social Security Administration is available, and then there's Administration and Elder Care Locator as well. And I'm going to let JoAnn go over this and how she can provide some personalized support and why it's important to work with a local representative.
Yes. So I have been in insurance since 2006, and I added Medicare, and it's my favorite part of the industry because it truly is a service that is life-changing to people. When selecting a Medicare plan, and even if you're not having any intentions of changing, whether you want to stay with your plan forever, that's great. But every year you should meet with your agent, meet with your local agent, look up all your doctors, your hospitals, your specialists, your clinics, your dentists, your vision provider, and make sure that they're all still in network for the new upcoming year. Check your prescriptions and your medications. You want to make sure the formulary hasn't changed, and learn how we can show you month by month how much your out-of-pocket costs will be for your prescriptions. The other thing about prescriptions, if your health changes or something goes wrong during the year, you lose a spouse, your income changes, you have a medical episode, your health changes, you no longer can drive, you no longer can shower or bathe yourself. It's very important you stay in contact with your agent so we can help you get services set up in your home or or different living situations for you. We can aid you and direct you to the people that can move this process along faster. Um, Find out if you're eligible for more benefits. So a lot of times, seniors don't qualify for Medicaid because the threshold is so low. You have to make less than $776 a month in our state. And but what happens if you make $800 a month? That's not that much more. So there's a lot of programs in place that seniors aren't aware of. And it's even harder to find help now during COVID because our state is so restricted on us being out in the community. So it's important that you reach out to a local representative who knows the types of programs that you have in your area to help you get assistance with maybe paying some of your copays for your drugs or getting your Part B $144 paid for, or getting assistance with your copays. You may not even qualify for the Medicare savings plans, but your local representatives can tell you which hospitals have those kinds of saving financial programs that will help you pay for your copays if you don't meet the threshold for some of the other programs. And so that's the value that you get from having a local agent instead of just calling a 1-800 number and not having anyone on your team throughout your year and throughout your Medicare lifespan. If you have any questions, feel free to ask us, send us an email, check us out on our website, or give us a call.
So definitely, and thank you so much for joining. Again, on the screen here is JoAnn's contact information. She is more than happy to help and meet with you. She's the best in the biz. She cares and she really wants to make sure that you get in the right plan. So please reach out. And JoAnn, can you mention your walk-in days for your enrollment center as well?
Yeah, so we have walk-in days on Mondays from 1 to 4 at our Northeast Heights office on Carlisle. And I'll put them in the comments, our addresses. On the west side of Albuquerque, Friday from 9 to 5, and Thursday from 9 to 5 at our Rio Rancho office. And I'll add all 3 locations in the chat so you have it and it's a matter of record. And then we do appointments all the rest of the years. We also have agents in Smith stores and Walmart, so you'll find us everywhere.
Absolutely. Well, thank you, everyone. We want to become your partner in care and help you and your members get access to the care that you need. So please reach out to JoAnn or myself. And with that being said, does anybody have any questions? Any questions? So we'll hang out for about 5 minutes if anybody has questions. Feel free to email or call JoAnn to set up an appointment or just to ask some questions if you have any as well. And you can also feel free to call me if you have any questions, and I put my number at the top of the chat as well. And we will also be in the exhibit hall. We'll have a little booth from 1:15 to 2 if anybody wants to swing by and have a one-on-one conversation with JoAnn or myself. So just let us know. And we hope this was informative because it is a lot of information. So if you need any clarification, we can help too.
It's been fun sharing with you guys today. This is totally different experience. I love people and I wish we could be there in person.
Absolutely. Maybe next year. Maybe next year we could be in person. That would be fun.
I hope so.
And it looks like we're not getting any questions, so we'll hang out for a little bit longer, JoAnn, and then we'll jump back on at 1:15 and see if anybody wants to chat with us.
Okay.
I'm gonna stop sharing here. There we go.
Well, besides the audio problems and losing you.
I know, but I thought it was great. I think you did an
Yeah.
awesome job. Thank you.
I
I
thought you
think
did too.
I'm really happy we partnered together, and I think we should do more stuff like this. I think we're a good team.
Yeah, I do. You remind me so much of my daughter, JoAnn. You remind me so
Oh,
much.
really?
Uh-huh. One day I want you to meet, when you come down here, she can have you run through the bosque with her. She does a run up our mountain. You could call it like a hike run, but it's a 13-mile run to the top of the mountain. And she also does hiking. She does skiing. She does everything. I would love to introduce you to, I have 4 daughters, but my daughter just went in. You have a lot of common interests. So if you ever come down, I would love for you to meet her and maybe plan something fun with her. Because
Oh, I will. I'm coming next. I'm thinking like late February, early March is when I want to come.
okay, well, they're still skiing there. Do you ski?
No, I've never been skiing. I've never been.
Ooh.
Maybe
Well,
I could try.
how about snowboarding?
I've never.
Okay. Well, I think it'll come easier than you think.
Yeah, hopefully. I can wakeboard and wake surf. I can do that.
Then you could probably
So,
snowboard pretty easily.
yeah, it's just I've winter sports I've never really been too into them, but I'm open. I like outdoorsy stuff. It's just I never make time to do stuff like that.
Well, we're the birthplace of the snow bunny because when you ski here, it's sunny and bright and beautiful with blue skies 99% of the time, and you literally get sunburned skiing because it's that bright and beautiful.
Oh my gosh. Yeah, I think New Mexico just sounds like such a beautiful place. And I was telling my boss, I told her, I was like, I'm going. She's like, oh, go. I'm like, she's like, you got to go. So I'm
Yeah,
excited.
it's a beautiful place if you like the outdoors and you're active. It's if you are coming here to go shopping, you're going to be greatly disappointed.
Yeah, no, it's okay. I have the Mall of America here in Minnesota, so I can get my fix that way.
Oh, and there's not skiing in Minnesota? It's cold there.
No, we have like in the north, I think, somewhere, but it's cold, but it's not really a hilly or mountainous place. So
Oh, you have to have cold with no skiing? That's sad.
yeah, there's cross country skiing, so people do that like through paths and stuff, but not the same.
Yeah, yeah. Okay, so 1:15, I'm gonna get started on my call list. I'm probably
Okay.
gonna go to breakfast with my family and then start calling on my call list, but I'll check back in at 1:15 online. Is it the same for
Yep.
our time or my time 1:15, not your time?
It's your time. Wait, let me see what it says. So it might be 12:15 your time. Yep. So it's 12:15 your time, 1:15 my time.
Okay. All right, we'll jump back on at 12:15 then. Okay.
Perfect. I'll
We'll
see you
see you
soon.
then.
Bye,
Bye.
JoAnn.